This is a podcast from the Nuffield Department of Medicine, and today we're interviewing Professor Ian Pavord about his research on asthma. Hi, Ian.
Hello.
So how big of a problem is asthma?
Asthma is a big problem. 5 to 10% of children and adults have a diagnosis of asthma and require treatment. Asthma is a common cause of hospital admission, particularly in the winter, when it contributes to the winter bed crisis that many hospitals have. And unlike many other chronic health conditions, key outcomes in asthma are not improving or have stopped improving over the last 10 years. So hospital admission rates for adults and death due to acute severe asthma have both plateaued over the last 10 years. So I would say it's a significant problem.
What are the different types of inhalers and what do they do?
Well, they're broadly in two categories. Relievers, which are often blue inhalers, which ease the symptoms of asthma but don't deal with the underlying cause of the symptoms, airway inflammation, and preventers, which are usually brown or purple, and deal with the airway inflammation, which is the basis of many of the problems that our patients have.
How is your research helping the development of new treatments?
Well, we're interested in measuring airway inflammation, and we've developed a number of relatively simple techniques that help us to get a better feel for the nature of lower airway inflammation. And we've been applying these measurements to patients with asthma for 20 years or more now. And our findings have been in many respects very surprising, in that it has been assumed that symptoms and measures of lung function, which we usually use in clinical practice to base treatment decisions on, are in fact not that closely related to either the nature or the severity of airway inflammation. So they're probably not the best basis on which to decide which patient needs anti-inflammatory treatment, who should have more or who should have less. We feel that objective measures of airway inflammation are a much better basis for making key decisions about anti-inflammatory treatment. And that's really where we are now as we speak.
What are the most important lines of research that have developed in the past 5 to 10 years?
Well, as a result of the new understanding of the relationship between airway inflammation and symptoms, and particularly our discovery that one of the major clinical manifestations of uncontrolled airway inflammation is an increased risk of asthma attacks, has been the development of much more specific inhibitors of eosinophilic airway inflammation. Now, these drugs had been trialled in asthma 10 or more years ago with very disappointing findings, but when we investigated the effects of a selective inhibitor of eosinophilic airway inflammation, mepolizumab, in patients who we knew had eosinophilic airway inflammation, and we looked at the main clinical outcome associated with airway inflammation, that is asthma attacks, we were able to show that mepolizumab was very effective. And this drug is now undergoing phase 3 trials and is likely to become a viable treatment option for an important subgroup of patients with asthma. So that's one very important area. I think there's a widespread realization now that the drugs that we have in the future are not going to work well in all patients. And one of the big clinical challenges is going to be identifying the right patient for the right drug, a process that we call phenotyping patients and phenotype-specific treatments. And that's very much my area of interest, and we've had some success in that area.
Why is your research important, and why should we put money into it?
Well, I've already mentioned that asthma is one of the most common chronic diseases, and the outcomes are not improving in the way they are for other chronic conditions. It's also a very important condition for the UK. We have some of the highest incidence and the worst outcomes from asthma of any country. And drug the existing drugs we have available to treat asthma are largely British drugs that were invented in the UK and are manufactured by British pharmaceutical companies. So this is a particularly important subject for UK PLC, and we need the next generation of effective treatments.
How does your research fit into translational medicine within the department?
One of the effects of measuring airway inflammation in a large number of patients is that one begins to recognise particular patterns of disease in patients that haven't been recognised before. And some of these patterns look so characteristic that it looks to me possible that we should be able to understand the pathogenesis and develop better and more specific treatments. And one of the things that attracted me to come to Oxford was that I had identified these groups of patients but didn't have any obvious way to move on with investigation and understanding of pathogenesis. And I felt that it might be possible here to connect these interesting groups of patients to very clever immunologists and basic scientists and really begin to dissect out what was happening and whether there are opportunities to intervene to the benefit of the patient. So that's one of the areas that I'd hope to achieve effective translational research. I'm very much at the patient side, but I hope to connect patients to scientists. And I think that's really what we've got to do. And we've got a big opportunity in Oxford, in the Nuffield Department of Medicine, because of the way things have been set up, to do that effectively.
Thank you, Ian.
Thank you.